I think, and I'm not talking about our treatment per se. I'm talking about treatment period. I think the moment that people in this field, if it is the mental health field, if it's addiction field, if it's the medical field, regardless, people, they are dealing with human beings. You need to start to look at people as individuals. They're not addicts. They are not patients, even. They are individuals. They're individuals with their own histories, their own DNA, their own difficulties, their own anxieties. And as Dr. Lowenstein was saying, I think to feel heard and even understood, not all the time we can understand everything, but we can definitely hear and we can definitely try to understand. And I think that's the moment when things change. On our field, because we treat patients from all over the country, we don't see them. So we are really selling a promise that I will care, that I will do everything in our ability, professional, individual ability to get you where you need to be. Does it mean that we always can do everything we want to do? No. But I think it's important for the patient to know that we're going to give our all. And there is no expectations of how, I mean, obviously there is a frame of, respect both ways and behavior. But if you stay on that normal frame, there's no expectation of how you should feel, what you should be, what you should look like. We want to be here. When he says Judgement, a lot of patients tell me that as they come in from the hospital to Domus Retreat, they're weak, they're anxious, they are hypersensitive, they don't know what life is going to be without opiates. So there's a lot going on physically and emotionally. But as Judgement gets them and say, I'm here. I'm gonna be here and get you where you need to be. Mm-hmm. At that moment, they feel, he got me. And I think this is what people in this field should be aware of. People have been beaten up quite a bit. It doesn't matter if it was society, if it was themselves beating themselves up. It doesn't matter where it came from. But by the time they still have the strength and the power to seek help, we should extend that hand and that arm and do what needs to get done.